Hi there, it's Mescher-Cox. Well, thanks for spending your Wednesday with us. So Jay and I specifically wanted to make sure we left enough time for questions at the end of this presentation. So please, any questions that you might have, it's the most common reason actually for patients to come to the doctors for low back pain in particular. So arthritis and more, we're noticing the role that inflammation plays both in arthritis, but in multiple diseases across the spectrum, chronic diseases, that is, in particular. So we'll jump right into it. So the title being arthritis and inflammation. We'll start with inflammation. You all might have heard about this in multiple fashions, but one thing that's very notable is that it's responsible for up to 80% of the diseases that we're seeing nowadays. Let me just check this. Okay. Up to 80% of the diseases that we're seeing in the modern world, non-communicable diseases. It's what it's saying is a disease that we don't get from, dirty water or from infections. That was 100 years ago. We don't see those as much now. What we're really seeing are these chronic diseases. So right at the top, you'll see what we're focusing this topic today on, which is arthritis. So inflammatory forms of arthritis, and ones that we'll be highlighting in particular, rheumatoid arthritis today, psoriatic arthritis, which is arthritis to do with psoriasis and gout, or that goes along with it rather. But the chronic inflammation we see doesn't just stop at arthritis. It's implicated in obesity, in heart disease, in other cardiovascular diseases, including stroke, type 2 diabetes, some type 1 diabetes even, because the rate of that has been increasing along with inflammation, inflammatory bowel disease. So you can read these on here, but also cancers. So breast, colon, prostate cancer, and lung cancer. So it really has a very huge and overarching role in everything that we're seeing in primary care nowadays, including mental health, and really very, very widespread. So the little piece that we're focusing on today with arthritis, it's one piece of the bigger puzzle. So please, I want for you to keep that in mind as we're going through, as you'll see in the presentation, because everything's connected, right? The blood vessels that are innervating our synovial, like the joints and the areas around our joints, those blood vessels, they have the same thing flowing through them as the blood vessels in our brain, as the blood vessels in our heart. So a huge thing that we're going to focus on too is blood flow, because if we're having a problem with blood flow, a lot of times we'll hear about that in the setting of someone that has diabetes. So they have some disease of their blood vessels because of the high sugar levels, high blood pressure, high cholesterol, right? It seems to always come back to those three in particular. But what happens is it's affecting the blood flow in a negative way. And again, that affects everything in the body. So blood flow, the three things of inflammation that we're going to focus on, there's three different types in particular: functional inflammation, adipose-related inflammation, which is a really cool thing to talk about, and autoimmune. So functional inflammation, there's a few ways that we get this. Part of it's just daily living. We go through inflammation and we're exposed to some free radicals and other inflammatory compounds, UV radiation when we're walking outside, even sitting inside. So this type of inflammation is part of life. It's just there. And then there's the next type of inflammation, which pictured here a little bit with this gentleman at the computer screen, because clearly that's not a normal human position to be in for 8 hours a day. But a lot of us are, and that's really inflammatory to the body. Similarly, additional wear and tear. So I put this in, as you can imagine, exercise is amazing for us and we want to promote it. But there are times when additional wear and tear on certain joints, there's no way around it. It's just as a function. If we're moving a joint in an abnormal way, or if we're just not cut out for certain activities, it's going to be hard to promote healing in that joint if we're doing additional wear and tear over and over and over. For example, if someone's not a runner and then they go try to run a marathon. So that's not the exercise that's going to be helpful. That's going to be a lot of inflammation on a body that's not used to it. Another just piece of fact about inflammation is the fact that our body is a machine. And so the joints, they do function just like other joints function. I mean, even to imagine a door hinge, right? So the function of the door hinge is to open and close the door. If there's a certain amount of weight on that door, it can keep opening and closing for so long. If there's weights or people that hang on a door handle, over time, that hinge is not going to work as well. So weight. Fact is, for every 1 pound of weight that we have at our waist, that's 3 to 10 pounds on the knees. The knees are hinges. And so there is the fact of, yes, there's a lot that we can do, and we'll be talking about it, to reduce inflammation from adipose or from fat cells. But weight is weight to the actual joints. So there's something we really need to keep in mind, of course, to be thoughtful and inappropriate and not a make wrong way, but definitely we need to address the weight factors when it comes into joints, which I think my colleagues at orthopedics, a lot of people, what happens is it comes across a little rough. So next piece, adipose-related inflammation. So the area that's so cool about this is that in the past, we used to think that adipokines, or it's adipocytes, it's fat cells. We used to think that they would sit there and just irritate us. You know, we don't want some extra fat cells on our waist or, you know, on our body in places we don't want them, right? But they don't just sit there and do nothing. They sit there and they actually are metabolically active. So this busy slide actually has a simple meaning. Those fat cells secrete to these different cells. The chondrocytes make cartilage, osteoblasts make bone. These different cells, they have different things that they secrete to. And most of these end up being inflammatory factors that lead to the progression of additional arthritis. So if someone's going for a knee, they want to have a knee replacement or a knee surgery, and the orthopedist will often say, okay, please, you need to lose 5% of your weight before we move forward with this. Yes, it is true. We need that weight off of the joint to take some of the pressure off. But a lot of times what they're going for is actually, we're wanting to also reduce all these inflammatory factors too. Because if these inflammatory factors are present, let's say someone even undergoes the surgery, but it's really hard to recover in this soup of inflammation. We need some healing to be involved. So we need to slow down all these inflammatory factors from being pumped out into the joints, into the bloodstream. In these ones, again, a bit busy, but the end game, what we want to see is, unfortunately, this leads to arthritis, both rheumatoid arthritis, which is inflammatory, but also osteoarthritis, which is just breaking down of that joint. This is a similar slide, but different in the fact that I wanted to call out that, again, these fat cells, they are producing all these inflammatory factors that can lead to arthritis, but not just arthritis. Those factors lead to cardiovascular disease, as pictured here on the right. And again, that cardiovascular disease, if the blood flow is limited, because now we only have a small amount of space to carry blood to those tissues of the joint, perhaps, joint capsule, I should say. If we can only get a little bit of blood flow there instead of a lot of blood flow there, we're not going to be able to have as healthy of a joint. We simply are not getting the proper blood flow to that joint. So cardiovascular disease is actually strongly tied with more joint pains. Insulin sensitivity or insulin resistance is what it should actually say, because when we see these inflammatory factors from those fat cells, again, they lead to more insulin resistance, which is type 2 diabetes, and type 2 diabetes, again, worsens joint pain itself. So if you're getting the picture here that if I'm coming across clearly, it's a very, very vicious cycle, because if we have more fat cells, they're going to produce more inflammatory factors. It leads to more of all of these chronic diseases, including obesity, which just stimulates more of that cycle. The third type of inflammation is autoimmune inflammation. So you can see the picture on the left. This looks like psoriatic arthritis, or this is what psoriatic arthritis looks like. These, we call them sausage fingers, or finger in cup, because the fingers are so inflamed. On the right side, you can see gout in the knee. The toe, which is common, it looks very similar. So this really angry looking arthritis, the inflammation that comes from autoimmune inflammation is mediated by inflammatory factors. It's your body inappropriately attacking itself. To say, sometimes people will ask, and I have another slide on it, but sometimes people will ask about like reactive arthritis, which we see after a viral infection or after an illness. So the body makes antibodies against that bug or that foreign invader. A lot of times those antibodies, those foreign invaders, the body gets a little confused, and then will also make antibodies, or the antibodies look like the ones on joints, and we end up attacking our own joints in that short period of time afterwards. I want to spend a minute on this because this is probably a good piece of where some of the interest has come, at least the questions that I have fielded. So there's rheumatoid arthritis on the right side and osteoarthritis on the left side. This is really common for people to come into our office and have concern for rheumatoid arthritis. A lot of people will come in and they're concerned about rheumatoid arthritis. I think a lot of times now, because there's this direct to consumer marketing, it's very unusual in the United States that drug companies can market directly to consumers. And a lot of times what they're also getting the consumers to find the need for the medication. So what we see in practice is a lot of people will come in and say, I saw this commercial for this rheumatoid arthritis medication. I think I have rheumatoid arthritis. Can we walk through that? Is that what I have? And by far and away, the most common arthritis is osteoarthritis. Again, very, very, very common. It's about half of American adults have osteoarthritis, as opposed to about 1% or less with rheumatoid arthritis. So it's worthwhile for us to walk through this. Okay, so osteoarthritis. So what happens in osteoarthritis? It progresses over time. So especially in areas, if someone had trauma to a certain joint, let's say a knee, a hip, a shoulder, that joint has then been weakened and they're more at risk for getting osteoarthritis. Osteoarthritis, a lot of people, they just leave the osteo off. When most people talk about arthritis, they mean osteoarthritis, but they just say arthritis. So I'm going to shorten it. But what we see is that the mechanical load, right? So that's any excess weight or any movement that's really abnormal and aging leads to cartilage degeneration. So the cartilage actually breaks down. So in this normal joint, this little area here, if you can see, I hope it's not too small on your screen, but this little light blue area, that's the cartilage. So it's just right over the bone, the cartilage on either side of the joint over those bones, that helps it slide back and forth. What we see then, the cartilage wears and tears, you start to get some inflammation there, and then you get some bone spurs formed. So this picture of osteoarthritis, you can see these bone spurs are forming where in a bone spur is literally like a growth of bone. So I describe this to patients as similar to like if you have a shoe on and that your foot is rubbing against that shoe in an abnormal wear and tear pattern, you end up getting a callus to the area. The body tries to protect itself by building a little bit more skin in that area as protection. And the joint does the same thing. So if there's abnormal wear and tear, your body will build a little bit more bone in that area. Unfortunately, that bone is not what we want. That bone ends up usually being rough, like little pieces of bone growth that come off of that joint and cause even more roughness to occur. You can get them inside the joint as pictured here. You can also get them on the sides of the joint. One piece that usually comes up with patients too, if we see osteoarthritis in fingers, because it's really common, people will usually come in and they'll describe having a lot of pain with a small growth on the side of their joints. So very similar here where it says mild inflammation, but right here on the sides, when bone is growing in the joint, there can be pain. Once the bone stops growing, usually a lot of the pain goes away with osteoarthritis. So especially with that bone growth, those little osteophytes or little bony islands that are growing. So again, that's osteoarthritis, by far and away most common. If we look at the rheumatoid arthritis and progression of that, what we see is that it starts with inflammation of the synovium. So the synovium is this fluid here, which looks point up here. It's the blue area on this normal joint picture, the fluid that's surrounding, that's inside this joint capsule. So there's a lot of inflammation in here because the body has made these antibodies that are inappropriately attacking the synovium. Because of all that inflammation, we see that synovium, that membrane gets really, really inflamed. And it starts to erode down the bone. So we see bone wearing away as opposed to osteoarthritis where we see bone growth. With that bone wearing away, you see the joint space gets narrow as well. A lot of pain and a lot of inflammation. So that pictured here. So both, you can see the joint space has been worn away, but in very different fashions. Rheumatoid arthritis and other inflammatory arthritis, it causes irreparable damage to the joint. So if there's a lot of inflammation happening and we don't address it, we don't try to bring down that inflammation, you can have joint destruction that will never get better again. That's also a bit different from osteoarthritis, which is more of a slower progression over time. There's a lot less inflammation that's happening only when the little bone is growing. Okay. So now let's go through arthritis. I pulled out a couple types in particular. So this is definitely not an exhaustive list. There's over 100 different types of arthritis. But if we tried to go over that, it would be so much information. It would be leaving you all with practically nothing to take away from today. So I wanted to focus on osteoarthritis because it's the most common, and then inflammatory arthritis because we get asked about it so much. So osteoarthritis, primary, that's where you've never had an injury there. You just start to get damage to that joint. Secondary is when it comes after an injury. The inflammatory arthritis, again, the ones that we've pulled out for today, rheumatoid arthritis, the arthritis that goes with psoriasis, so psoriatic arthritis. And very important to note, not everyone with psoriasis has psoriatic arthritis. But if someone does have psoriasis and they have arthritis, we need to check for this because we need to make sure that we address the arthritis or the joint pains before there's irreversible damage, because it's one of this inflammatory arthritis where we do need to take care of that inflammation. And crystal induced, so gout, and then pseudogout, because sometimes it's not true gout, it's a different type of crystal that's in that joint. Septic arthritis, I put up here, but it is not so common. It is a medical emergency, but I put it up here because sometimes if people see that they have a very inflamed joint, it's one of these, is it inflammatory arthritis or is it septic arthritis? Septic arthritis, we need to deal with in hours. It's very, very quick. It can get very bad quickly. So important enough to just put it up here in this talk of inflammatory arthritis to rule that out if there's any concern. So osteoarthritis, again, the most common type of arthritis. I put this in here to remind myself, honestly, to mention about the bony growths, because we see so often when people come into us because they're having those, the pain at their fingers. So if you can see my cursor here, it's at these joints. So these little black lines, on x-ray, bone is white, black is not bone. So these spaces that are black in here are the joints. So if people have some growths or pain right at the joint right there, typically on one side or the other, and it looks like there's a little nodule or nubbin that's growing, really most commonly that's osteoarthritis. If you have concerns for that, you're not sure what type of arthritis, but you really want to make sure that it's not an inflammatory one, your doctor can do, oftentimes on a clinical exam, like us looking at your hands, we can tell. Otherwise, we could do an x-ray and be able to really definitively tell that way. So about osteoarthritis, just to mention, so this on this x-ray, these areas that are black in between the bones of the fingers, those are where the joints are. So if you can see my cursor here, this is where I was pointing to, where if people are having pain in this area, these areas, right on the sides of the joints, that's something that's most of the time it's osteoarthritis if it's right where there's a little growth, but your doctor can do the x-ray to rule out or to really evaluate. So rheumatoid arthritis, the most common type of inflammatory arthritis. It's interesting because it is a mix of genetics and environment. The things we know that if people live further from the equator, they have more of a risk of rheumatoid arthritis. This isn't just rheumatoid arthritis, multiple sclerosis is the same way. But right at the equator, where people live, where it's warmer, we see it less. And then when you go to the sides of the globe, the cooler climates, we see more. And when we're talking genetics and environment, we'll talk about that when we get to the treatment section. The hallmark is that it's multiple joints and typically the same on the two sides. So usually people will describe where they have hand pain, where it's both hands, or it's both knees, both shoulders. The other piece of it, not to get all into the diagnostic criteria, because there are a lot of criteria with it, but people also describe with rheumatoid arthritis that it takes them a long time to get out and to not be stiff anymore when they wake up in the morning, like 2 hours of stiffness. It can be very significant. And this picture is quite a classic picture because there's medical term, we call it ulnar deviation, but where the fingers move out towards the little baby finger. So very classic to see this kind of a change. The other thing is that we can see some rheumatoid nodules, if you can see my cursor here, and that's associated with rheumatoid arthritis. That can happen in the elbow as well, or other places in the body. So again, this is the irreversible damage of the joints, and that's why we try to get on some treatment. If it is a true inflammatory arthritis, get on a treatment before that damage has occurred and can't be reversed again. So treatment. So I'll spend my next 10 minutes before we go to your questions on treatment, because that's where we can really hopefully help. So I hope what we've gotten to so far is the big takeaways, that what we want to do is decrease inflammation. So really for treatment, our goals are to decrease inflammation and to improve blood flow, right? So for decreasing inflammation, overall, all these inflammatory syndromes are going to lessen. If we increase blood flow, then we can get blood to the area. With more blood flow, the areas can function better, or at least function normally. So of course, we'll start with nutrition. So the big thing on the bottom of this, I really like this food pyramid, because I think it represents what the average American really can do. You know, it's not, the goal is not to say, okay, everyone change your diet 100% and never ever have anything bad for you. It's just not real. So the goal here is to show, if we have our diet, we really want to have a lot of anti-inflammatory foods in there, then we need to make the base of our pyramid, like the majority of the foods that are being introduced to our body, anti-inflammatory. So vegetables, huge, huge, huge. So the bottom of our pyramid, half of every plate at least. Also fruits, very high in antioxidants. Those antioxidants, fruits and vegetables, those antioxidants will help neutralize free radicals and help your body heal in that way. The beans, lentils, and peas. This includes tofu. This includes hummus, these bean equivalents, tempeh. Very high, again, in antioxidants. Whole grains and potatoes, nuts and seeds and avocados, although they're calorie dense. So just be cautious, especially if we have weight we want to release. And then the other foods. So the ones to have sparingly. So foods that are low in antioxidants and low or devoid of fiber altogether, and are just adding a bunch of calories and adding inflammation to your body, to minimize those. The other way to look at it, time and time again, in studies, they've found that the Mediterranean diet is associated with the least amount of arthritis. Mediterranean diet is a plant-based diet. They do have more fish and more olive oil than what a number of specialists would recommend. But the things to highlight, again, the vegetables, and specifically to highlight spices and herbs, because that's the highest amount as far as ounce per ounce of antioxidants that we can get. And a great way also to be avoiding the salt, which is going to negatively affect our blood flow to our joints. I wanted to call out specifically nightshade vegetables, because a lot of times people will avoid nightshade vegetables because of the concern of arthritis. So it's not for nothing. There is a compound in there that they perhaps could cause inflammation. So it's solanine. There's no scientific evidence to truly suggest that nightshades trigger arthritis flares, but I usually tell patients, you know, if your diet is pretty good already, and if you do want to go ahead and do a trial of them, then go ahead and try without nightshades for 3 weeks. If it helps, go ahead and continue it. If it doesn't help, then please add those foods back in. What foods are nightshades is eggplants, tomatoes, red bell peppers, potatoes. They're so healthful, and they're associated across the board with so many health benefits, decreasing dementia, decreasing cancers, decreasing risks for obesity and diabetes and heart disease, that really we don't want to be removing those from our diet unless we know that it's a specific trigger for you in particular. So please test it yourselves. And I put this up here because a lot of times, you know, we'll do these talks, and I think I've called out before, in a lot of times we'll look at our own diet and we'll say, well, gosh, I'm doing pretty good, but I'm still having symptoms, right? So if the average American is really getting 6% whole plant foods, and our goal is to flip that totally 180 flip, right? We're only perhaps 6% or less is coming from non-whole plant foods. Really to take a good look at what is going into our diet. If we're not where we want to be, really true good look at, okay, well, how many servings of vegetables am I getting? How many servings of fruit am I getting a day? And drill down. And so we can really be honest about what's going in. A lot of people will ask also about supplements. Usually I tell people if a food or a supplement or something is made in the lab, it is not for human consumption. It is usually something where someone can make a lot of money on that product, but it's not a health food. So I'd recommend that for even things that people ask about routinely, which is a lot of supplements, a lot of protein powders, collagen powders, those types of things. Typically, those are formulated in the lab and not typically beneficial to someone's health, except for the studies that those marketers are putting together so they can sell their product. To answer the question that may come up about what about turmeric, what about curcumin, those types of things, I'd want to flip back to this slide just as a nice reminder that those are actually spices. They are not actually supplements. They're put into a little capsule and sold that way, but they are actually, it's actually a turmeric root, and it's a whole food. Okay, so that's the nutrition piece. As far as exercise, motion is lotion. I think every physical therapist ever has had this drilled into their head. Motion is lotion, rest is rest. I hope all of us drill this into our head because it's really, really, really true. For osteoarthritis, for rheumatoid arthritis, for all, across the board, for back pain, what we see time and time again is that the more we can move around, the better we are. Part of this is because of the blood flow phenomenon, right? So if we have an area that needs extra healing, how do we get those healing compounds to that area if we're not moving the blood around our body as easily? So definitely, the more we can move, the better. Sleep is critical, especially because sleep, that's our time for rest and repair. That's when our bodies can clear out the cells of toxins and do all of the deep housekeeping. If we can't do that, if we're not getting enough sleep, then we're going to start to feel the issues of not having time for repair, the chronic pain. The next two pictures I put in here for de-stress. So de-stress is also a huge piece, especially in our American society where it's pretty common for us to work a lot and run around a lot. And if we're sitting, a lot of times people have the thought of, gluttony or, oh, we shouldn't be resting this way. It's really, really important for your joints. Yes, motion is lotion, but specific time to de-stress. So we can get those inflammatory factors that were shown on one of the first slides. Those ones are higher in times of stress. In times when we can de-stress and really relax, we see all of those factors lower in our bloodstream. Or if this type of thing does it for you, whatever pictures or environments make you calm and actually really stimulate that for you, please put it on your screen, put the posters up in your room, whatever you can do to get more of that greenery if you don't have it available to you outside your door. Now, one big piece that I really want to talk with you all about, this is probably the most important piece, is behavioral change, because a lot of the things that I ran through are probably things that you all have heard before, especially if you've done a lot of your own research on arthritis. And actually, I find a lot of patients that do suffer from arthritis have been really avid researchers as far as looking into what they can do on their own to help with their arthritis symptoms. So one of the big things is time and time again, we see these same things that come up, right? Regular movement, regular sleep, regular consumption of fruits and vegetables, but really the knowledge is not the piece that we need. We need the applied knowledge. How do we make that work in our life? And how do we get that to be our new norm and our regular? This book is fantastic. I've sent a lot of patients to it. Since I don't have too much time with you all today, I do want to just point it out. I would really highly, highly recommend it. It's a quick read, but hopefully then you'll go back through with a fine-tooth comb and glean a lot of information about it. So I'll stop here. It's 12:40 and I'll take some questions.
Thank you, Dr. Cox. That was amazing. Really, really a lot of wonderful information there. I want to go ahead and put my 2 cents in about the atomic habits. Read it. It's a good one. So let's go ahead and go through some of these questions here. So the first question is, which is worse, OA or RA?
That's a good question. So I would typically say RA. So the reason why I hesitate at all is because since both of them can be inflammatory, but a lot of people have found that with rheumatoid arthritis, in fact, there's a really well-known cardiologist, her name is Monica Agarwal. She herself had rheumatoid arthritis, but with lifestyle change has dramatically changed. Her rheumatoid arthritis is not active at all, and she does not have symptoms from it. So yeah.
That's good news. That's good news. How do we stop or get rid of bone spurs in arthritic joints?
Okay, that's a good question. And it reminds me that there's a slide I really wanted to put in that I didn't, so I'll speak to it. So we cannot get rid of bone spurs once they occur. If the bone spur is in a location where it's, causing fraying of tendons, that type of thing, they can go in with surgically and remove those bone spurs. I would not recommend it unless it's absolutely necessary, because anytime that they go into the joint, I say I guess we, since I am part of the medical community here. So when we go into a joint, even for an arthroscopy, which is when they go into the joint to look around, the act of going into that joint is so disruptive to the body, it increases that person's risk of arthritis in that joint. Some studies say it's up to 600% increased risk of arthritis in the joint after an arthroscopy. But very well known that it does cause an increased risk of arthritis after going in. So unless you really have to, then please don't go that way. So the slide I didn't put in that I wanted to was, some people have very, very severe arthritis on X-ray, but don't have very many symptoms. Other people have very mild arthritis, and it will call that out in the report, mild arthritis, but the person's symptoms are really severe. So there's 2 pieces at play. One is the actual, what the joint looks like in osteoarthritis. In osteoarthritis, some people have, a lot of these bone spurs that have formed. But it might look terrible and the person doesn't have very many symptoms if they lead a very anti-inflammatory lifestyle. But on the flip side, if someone has a very inflammatory lifestyle, even if there's not too much arthritis that we can see on X-ray, they can feel significant pain because of all the inflammation that's constantly going into or staying in that body.
Very interesting. Very interesting. Next question. What is systemic infusion?
So systemic infusion. So I'm not sure if the question is for systemic inflammation, perhaps. There are infusions that we do as treatment for inflammatory arthritis. There's multiple different treatments in that sense. Those are infusions. I'm not sure, Jay. What do you think it was?
It was on the OA versus RA slide, and so I think it was yeah.
Oh, I'm sorry, and that was, I couldn't see it. So systemic infusion in that, is treatment for the rheumatoid or inflammatory arthritis. So medications.
For osteoarthritis, when knuckles begin to have small bumps, is that the start?
It can be. So very commonly it is if there's bumps like under the skin.
Lori, I see that your hand's up. If you have another question, please go ahead and pop that into the Q&A. I've read somewhere that some veggies can cause, you covered this. So some veggies can cause inflammation like bell peppers. Are there any that we should avoid? And you answered that one very, very well. If you have additional questions about these, go ahead and pop them into the Q&A. Again, as we work through, we'll get to them if we can. Oh, just a couple of comments here. Sharon says, fantastic presentation. Thank you both. Thanks, Sharon. Good job, Dr. Cox. Really, really fantastic. And Lily says, thanks so much for the wonderful talk. Okay.
Right.
And Misunderstood say, just want to thank you for your time. Wonderful. Okay, Lori did do a follow-up question here. Excellent. How much sugar intake causes inflammation? That's a good question.
That's a good question. So sugar intake, so natural sugars that are found in the world so if you think about if you think about sugar that's found in the world, it's sugar cane, right? Or it's natural sugars and fruits, that type of thing. So those sugars are not concentrated. They're with their fiber. They're in a natural form. And it's a small amount that you would get along with the fiber. That does not cause inflammation. The thing that causes inflammation is if we take sugar cane and instead of, back in the olden days, they'd take sugar cane and then chew on it, right? So you'd get a little bit of sugar, a little bit of sugar, a little bit of sugar. Nowadays, instead of sugar cane, it's super concentrated white powder, right? So that in that concentrated form, it will cause inflammation in the body. So the answer is any amount of added sugar.
Right. Outside of their beautiful natural packages that have all of the things that help to facilitate it to absorb appropriately and the components that our body needs to heal. Okay, another quick question here. Before Atomic Habits slide, I missed the importance of colors around us.
Okay. So Lori, I had put up that the slide of in the sense of de-stressing. So humans in general love being in nature. We're calmer in it. Our heart rate goes slower. Our breath, we breathe slower. Our cortisol level, their stress hormones, those go lower. So it's very, very healthful for us to have that calming effect. So when I put up these slides, it was to see, whatever we can do to de-stress, to get out in nature in particular, that's incredibly helpful. So if you can't get out in nature, having pictures around you of pictures of nature or plants in your office or home, that type of thing. So just to bring down those hormone levels, which also cause inflammation, the high cortisol and stress hormones.
That is absolutely beautiful. Okay. If we don't have any more questions, oops, another one popped up. Thank you, Dr. Cox. I just saw a rheumatoid specialist, and you told me everything and more than she did. I appreciate your help.
Oh,
wonderful.
Thank you. Thanks. Well, our hope is to always be helpful. So thank you all for joining us. We're here, whatever we can do to help. So we'll give you back a little bit more of your time. I believe Jay probably has a couple announcements, and then reach out to us if we can be helpful.
Oh, one more question. Legumes, uric acid causes more pain.
Is that for the person that's writing that? Is that for you in particular? Some people have noticed that with some people will say, oh, if you soak your beans, it's more helpful. If you find, or if anyone finds certain foods are bothersome, definitely worthwhile to minimize or take out those foods, like a food elimination diet of certain foods. And then the ones that are really healthy, try to add them back as you can. As far as I'm aware, it's not a widespread. How can I reach out to Diana asked? So Jay will give our information in the chat, or I will when she's talking.
Absolutely.
Yeah.
So beans are legumes in general are so incredibly beneficial that that's not somewhere you'd want to start, right? You definitely want to try and include them unless sorry, what I meant to say was it's not something that you want to just eliminate as like prophylactically. You don't want to just get rid of them thinking, oh, like they could possibly cause problems. Make sure that that is specific to your situation. They're so unbelievably beneficial that we definitely want to include them. Everybody should be eating their beans every day if possible, if you can tolerate them. Okay, another question here.
Beans,
Which,
lentils, and peas. And I want to make sure it's super clear. That's not just Jay and Megan talking. That's study after study after study. So the Arthritis Foundation, all the research that's out there, they recommend Mediterranean diet over and over and over. And the Mediterranean diet is heavy in legumes. So again, just to make sure that it's really clear, it's not just our opinions. This is based on hundreds
science.
and thousands of studies.
Yeah. Which
Oh.
knee injections are helpful for knee arthritis? Cortisone, hydrologic acid.
Okay, so that's a good question. So if there's osteoarthritis that is long-term, cortisone is a very, very potent anti-inflammatory agent. The hyaluronic acid really functions as similar. The theory behind the hyaluronic acid is that it's a thicker material and it will kind of help fill some of that synovial fluid. It does not. Neither one of them help in the long run. In the long run, we see more degeneration with those injections. We do give them, especially if someone has an acute pain flare and they just need to get over that acute flare of inflammation. We will offer that as a way to get over the flare. Or the other way that we give them pretty regularly is if, I have a lot of patients in their 90s and their 80s, and they do not want to go under surgery, but they have a lot of pain, and those injections help them keep going day to day, even though we know in the long run it's not going to be the best. 80s, 90s, we're looking for quality of life. So I hope that answers the question. We used to use them more widely, but more and more what we're seeing is less is more. And doing the arthroscopies, we're doing more harm to the joint, right? When we're going in for a knee surgery, doing the injections into the knee, we're doing harm to the joint. So physical therapy is turning out to be like the gold star. Like that's really what we want: anti-inflammatory lifestyle, and then physical therapy to rehab and to help us move in different ways to help with those wear and tear patterns on the joints.
Another question popped up: wine and inflammation.
Okay, this is so thank you for the question. So I left out a whole huge piece because I didn't know how to put it in a concise fashion, which is the microbiome. So the microbiome is awesome to help bring down inflammation in our body. So wine or other alcohols, I guess I should call out by definition, they are poisonous to humans. They are a toxin to the human body. They do cause cancer. So it's not a health food by any means, but they're not just toxic to us. It's also toxic to all the really good bacteria that live in our gut. So a lot of our immune system and our own inflammation, or our ability to tell what's self or not self, like when it comes to those inflammatory arthritis and autoimmune, part of the concern is that a lot more of us are attacking ourselves, like ending up with autoimmune disease where we're attacking ourselves because the body's gotten confused. It doesn't know what is self and what is not self. So how do we know what is our cell and what is not our cell? The bacteria that live in our gut are critical to help tell us what's ours, what's not ours, because it will help determine like what can actually get into our cells in our guts. So I would highly recommend avoiding it if someone's dealing with acute inflammation, especially avoiding it at that time.
What is helpful though are those grapes. So especially the purple, the red, the black grapes, those are fantastic for you. And the historical kind of benefits we had tied to wine is all about the grape, not the alcohol itself. So eat those grapes. Oh, go ahead. Do you have any last thoughts, Dr. Cox, before we? Oh, no, another question popped up. Okay. I love these questions. Keep going. Keep going. Bile is dangerous, ?
I would have a very hard time answering that question. Bile is a compound that's made by the liver, stored in the gallbladder, and that it's secreted into our gut to help break down certain compounds of foods that we eat. So we definitely need bile, but I'm not sure the context of the question. So that might be one maybe to reach out to me if you do have questions in particular about it, so we could go back and forth a little more.
Absolutely. Do you have any last final thoughts before I go over some resources, Dr. Cox?
No. So I know we went through the arthritis in a little bit. I'm not sure what you all were expecting today. We did not focus on the treatments like the prescription medications. If people have any interest, we can always do a 2.0 on any of the things. We could probably do 5 sessions at least on arthritis and inflammation. But just any feedback you all have for us, please. We would love to help.
One more excellent question. So liver cleanse is not good.
I would say it's fantastic with vegetables and fruits and beans and lentils and peas and whole grains. I know that sounds cheeky, but really serious. The things that clean out the liver are high fiber foods and foods that are high in antioxidants. So it really is the vegetables, fruits, legumes, and whole grains that do the liver cleanse. And you need them in their whole form because you need them with their natural fiber. Do you want to go ahead, Jay? Do you have something else?
Yeah, that's absolutely crucial. Our body has its own mechanisms for detoxifying. A lot of these detox products can actually be dangerous. They can damage our microbiome. They tend to be very, very expensive stool softeners, or a lot of teas. There are lots of things out there that as Dr. Cox was talking about, the supplements, same thing, a way to make money, but we want to facilitate our body's natural detoxification mechanisms, and we do that by giving it what it needs to thrive. Okay, maybe not last question, but the one that just popped up, what about gluten?
So there is such a thing as celiac disease, and some people do have a true allergy to gluten. So of course, for those people, they need to avoid gluten. There's a lot of people right now that are suffering from gluten intolerance, but the problem is not the gluten. The problem is that the gut, the microbiome, those bacteria that live on the walls of our gut, if they're not healthy, they're not making a really thick mucus layer that can help the body tell what to let in and what not. So I hope this is going to come across clearly, but it's if gluten is irritating the body, a lot of times it's a gluten intolerance because our gut bacteria is not healthy. And so it tells us that we actually need to increase the fiber in the diet because that's what the good bacteria eat. And then over time, a lot of people that did suffer from a gluten intolerance actually can end up having it just fine, which is great because a lot of the foods with gluten in them are incredibly healthful, and we don't want to get those out of our diet.
Exactly. All right. I am keeping an eye on that chat. I think we're good. Now, remember that if you think of a question 5 minutes after we stop here today, these are ways that you can reach out to us. Prevdoc.com is the website for disease prevention and reversal. And there's a lot of videos on there. So if you want to look up past topics we've seen and, have a look through, and we have other doctors that have and healthcare professionals that have spoken with us. We've done 2 summits, and so there's a lot of really good info on there. Dr. Megan Mescher-Cox has a website. She does Walk with the Doc the first Saturday of the month, 9 a.m. Meet under the Ventura Pier, and it's a gorgeous walk after a short little stretch and a little bit of a talk, and really an opportunity to chat with other walkers and healthcare professionals, which is a very unique opportunity. Go ahead and check more information about that on her site, meganmeschercox.com. And for myself, I have my free weekly plant chat every Saturday at 11 a.m. Everyone is welcome. Plant curious or plant-based or anything along the spectrum. It's not about being perfect. It's about getting healthier. And that's what we're all about in that group. And everyone is welcome. Just reach out. And if you have a question that you weren't comfortable asking in the big group, I get it. Reach out to go ahead to these sites and reach out to us. And we're happy to answer questions or, give you more resources if that's what you need.
Mm-hmm. I have a contact me page on my website, so that will come directly to me. So, okay. Well, thanks for sharing your lunch hour with us.
Yeah, that was fun.
Happy Wellness Wednesday. Take care.
Thanks, everyone.